Members of the, let's turn to Ondo State, where members of the, now let's turn attention to Ondo State, where it says the Ondo State government says it will not tolerate any unwarranted disruptions to its health services by nurses in the state. The state head of service, Felix, in a statement made available to journalists, urged nurses to allow good reasoning to prevail since there is neither any disputation nor deadlock. Members of the National Association of Nigerian Nurses and Midwives in the state had on Thursday announced their decision to embark on an indefinite strike starting from Friday, which is today. The state chairman of the association, Felix, at an emergency meeting said, members are going on strike due to poor welfare policy of the state government. But the government urged the nurses to cancel the planned action, saying there is no basis for such at all. The state head of service noted that government is surprised to learn about the planned action in the news when there is no dispute or any unresolved issue. The Ondo State government says it will not tolerate any unwarranted disruption to its healthcare services by nurses in the state. The state head of service, Felix, in a statement made available to journalists, urged nurses to allow good reasoning to prevail since there is neither any dispute nor deadlock. Members of the National Association of Nigerian Nurses and Midwives in the state had on Thursday announced the decision to embark on an indefinite strike. All right, let's bring in the state head of service, Felix. He joins us now on the news. Good to have you join us. Mr. Felix, just to be sure that you can hear me.
Yeah, I can hear you now.
All right. So the nurses and midwives in Ondo State say they are going on strike, but you were saying there is no dispute or deadlock. I just want to understand, I mean, they say they have been having this conversation with you since 2023. What do you make of that?
Frankly speaking, there is no reason whatsoever for them to embark on this unfortunate action. About 2 weeks ago, we met in my office. That was when they raised the issue of coherence. Before then, you will recall that in November, our state, Ondo State, under Governor Dr. Ayedatiwa, was among the very first states in the Federation that implemented minimum wage. We even exceeded the national benchmark. Now we discuss, and the table that we came up with was agreeable to everyone, including both the Medical and Health Workers Union and the Association of Nigerian Nurses and Midwives. And it was promptly implemented. Everyone collected his or her November salary under the new template. Surprisingly, mid-January this year, they came and pressed for further pay raise. We discussed the issue. And as usual, we put it before our listening governor. And it's being considered. And in fact, when I went to Mr. Governor, because of his love for the public service, and especially for the health sector, directed that we should work out the detail in earnest for him to consider.
But if you could just give me a minute to list some of the things they have said. Just a minute, Mr. Felix, because they've talked about the lateral conversion of nurses with first-degree certificates and uniform allowance for nurses as captured in the public service rule. They've also talked about payment of outstanding promotion and hazard allowances, the creation of a conducive environment in health facilities. I mean, these are some of the things that they have stated, and they categorically say none of these have been addressed since 2023.
We need to be confronted with the fact that nobody in Ondo State.
Please go ahead.
I can hear you.
I can hear you. Please go ahead.
Okay, on promotion, let me reconfirm that nobody has promotions in areas in Ondo State. All our health workers, including the nurses, have been promoted up to date, cash backed. Let them come forward to confront us. So that is no issue at all.
You have said that the strike would not be tolerated. If they do decide to proceed with a strike, what will be the action of the state government?
Now, since there are no basis for the strike, there is no point for them to continue with it. My office is open. They have unfettered access to it. Of course, we have invited them to the meeting at about 2:30 today. We hope, as we have said, they will allow good reasoning to prevail. Let them come around and then we discuss. But there is no point at all, considering all that Mr. Governor is doing in the health sector. There is no point for them to embark on this strike. If they are talking about conversion, it's done year in, year out, and it's just a mere personnel matter. And as we have it in the state, if you are moving from the subordinate nursing cadre to the superior cadre, we have a guideline, and it's not strange. This is done year in, year out. So we cannot see the facts. Let them bring their facts to the table, we'll talk about it. But as I said in my release, there is no disputation at all. None whatsoever. Government is open, and we begin to, we keep our communication line open. So we appeal to them to shelve this unfortunate action so that we don't put our health delivery system in jeopardy.
All right. Well, following this development, thank you so much for your time. Head of Service, Ondo State, Mr. Felix.
Thank you very much.